Largely responsible for transmission of rabies in Asia is the dog. Besides cats, monkeys, it must be noted that the saliva of a rabid animal is infective 2 to 3 days before signs of rabies appear in the animal. Clinical features. Rabies victims suffer horrifying symptoms and eventually die. Most pathetically, they know that the disease has no cure and they will die soon. The rabies victim dies a solitary death in isolation hospital ward, away from relatives, dear and near ones. The victim's hands are invariably tied to the cot by bandage or ropes. They are unable to drink even sips of water, undergo great pain and mental agony, and in most cases with full awareness. Prodromal phase. Tingling and numbness are experienced at the site of bite 2 to 3 days before clinical symptoms appear. Later, low-grade fever, headache and body ache are reported. Clinically, subsequently, patient develops painful spasm of the muscles that control breathing and swallowing, resulting in drooling of saliva, and person cannot swallow and voice may get hoarse. The pupils may get dilated. Tears and perspiration increases. Blood pressure becomes low. Patient develops hydrophobia, fear of water. Photophobia, fear of light. Aerophobia, fear of breeze. Later, as the disease progresses, patient gets agitated, combative and destructive. Shows mental confusion, becomes sensitive to touch, noise and light, gets extremely thirsty but unable to drink because of painful spasms in the throat, develops dehydration, loss of muscle tone and listlessness is seen in majority, and eventually death occurs in 3 to 5 days due to respiratory paralysis or cardiac arrest. Paralytic rabies is seen in about 20% of rabies cases. Here also, initially, the patient experiences tingling and numbness at the site of bite 2 to 3 days before the clinical symptoms appear. The paralytic type of rabies is seen usually in patients who had taken some anti-rabies vaccination in the past.